Hi, I'm Dr. Alan Mendelsohn from Eye Surgeons and Consultants, and this is Glaucoma National Awareness Month. Very, very important. We're always asked, well, how do you actually know that I have glaucoma? There are several components of the eye exam. The first component, of course, is checking the vision on the chart. The vision should be comparable to what it was before, but a quality of vision is an important indicator. The second thing is the pressure measurement. So to check the pressure, patient has their chin in the chin rest, just as our sample patient is now. And what happens is the eye is numb. We bring a little instrument called an applanation tonometer up very, very close. We gently touch the eye. It gives us a reading. And her intraocular pressure is read in millimeters of mercury. For Hannah, it's actually 16, which is superb. A third component is we want to look at the drain in the eye. And in order to do that, there's an examination called gonioscopy. We have a little lens that's kind of like a contact lens that's attached to a little handle. What we do is, previously we placed a drop on her eye so that she is nice and comfortable. We rest this right up against her eye, and that allows us to look at the drain in the eye. So what I'm going to do is I'm going to remove the applanation tonometer out of the way. I'm going to change the lighting. And now I very gently approach the eye. I gently rest the gonioscope on her eye. And I'm looking straight ahead, and now there are 4 mirrors, and I'm looking at all 4 mirrors, and she's going to stay in position for a moment, but her drain was wide open, so that's very, very good news. That's the third component. Number 4 is it's always so very important to put drops in to dilate the pupil. When the pupil is dilated, we have a phenomenal look at the crucial nerve in the back of the eye called the optic nerve. And in the family of conditions called glaucoma, it's the optic nerve that has an impairment. Now, there's a specific lens that I have found to be terrific. It's called a 78 diopter lens. So what happens is this lens, what I do is, now let's pretend that Anna is dilated. We've waited a while, the drops are in. And I hold the lens in front of her eye. I shine the light into Anna's eye, and I have an absolutely spectacular, highly magnified, 3-dimensional view of the nerve called the optic nerve. You can go ahead and sit back, Anna. So that's the next component. And of course, between every patient, we remove the chin rest paper. After the patient leaves, we clean the instrumentation. But as part of the examination, I call it the coal miner's light. This is what's called an indirect ophthalmoscope. I put it on my head. And with this indirect ophthalmoscope, when I look in the back of her eye, when her eye is dilated, Anna, look to the right for me, please. And look up to the ceiling. And to the left for me, please. Down to your toes. Excellent. With this light, it gives me a spectacular 360-degree view of the periphery of Anna's retina. So, in summary, a complete eye exam is so very important, but we make the diagnosis by checking the vision. We want to check the pupil, make sure it's healthy. We look at the drain in the eye. We do that with that little instrument. It's called gonioscopy. The little instrument's a gonioscope. We use the handheld lenses to look at the optic nerve once the eye is dilated. And then we put on the coal miner's light to get a look in the periphery. And with all these components, we can thoroughly evaluate the eye, not just for glaucoma, but for other disease entities as well. And that's our step-by-step approach in the office of diagnosing glaucoma. And in the next segment, we'll talk about testing. Thank you very much.